Well, Andre Ilbawi is a technical officer at the World Health Organization's Cancer Control Unit. He joins us now from Geneva. Thanks so much for speaking to us. Cancer is actually the second leading cause of death globally. We're talking about 10 million people a year dying from various cancers. And some 70% from your own statistics at the WHO, 70% of cancer deaths actually occur in lower to middle income countries. Why is that? Why such a huge gap?
There is, as you mentioned, a massive public health challenge with cancer. It's a disease that we've talked about in high-income countries for many years, but it's in the past few decades we've recognized that cancer has been a slow-growing epidemic that is now reaching a size we can no longer ignore. Why is it, as you're asking, that we are seeing this increase in cancer cases in low and middle income countries? Well, some of it is in fact a success story, as we've been more effective at treating infectious causes of death, maternal death. Well, in fact, people are living longer, and as they live longer, their exposure to cancer risk factors also increase. This is now causing this double burden of disease, the historic communicable diseases, and now the burden of disease from cancer and other non-communicable diseases. And as you point out, 81% increase, perhaps a better way to say it, is a near doubling in the next 2 decades. That will require a near doubling in the capacity to treat and care for all people with cancer. This is a major public health area of interest and one for action.
Right. And as we said, I mean, tobacco is one of the biggest and best known causes of cancer. Yet among, the people that can really least afford or get the least access to health care, tobacco is the most sold. I mean, why is that, and what can be done about it?
Yeah, as you've raised in your last interview, it is an important message of health literacy and health promotion. How can we get the message out that tobacco is in fact one of the leading causes of death in all disease categories across the world? We still have 1 billion smokers around the world, 1 billion. Now, there is something in messaging that we need to focus on and enhance, not only from the information that's presented to youth, but also from a system and society perspective. How can we use opportunities as a community to promote education opportunities, and how can governments get involved to do their part? We know, for example, in Turkey was one of the 2 countries now that has fully implemented the measures to reduce tobacco exposure and to promote tobacco control. This is what we're calling on governments around the world to invest in, which is a full package of interventions, not just raising the awareness, which is absolutely critical, but thinking of the broader activities that are required for tobacco control.
Right. Other than tobacco then, walk us through, some of the major causes of cancer that people can actually do the most to avoid.
Yeah, this is an important question. So just as a point of reference, about 1 in 4 cancer deaths, 25% of cancer deaths is due to tobacco. So it really is the elephant in the room. There are others in which we as a community and individuals can act on. Some of the important ones to think about: healthy diets and maintaining a healthy body weight. This is an important one that we see growing in every country around the world. In the past 15 years, we see obesity rates have increased in effectively every country. And this is now growing as a public health risk factor and one that contributes to cancer, about 5% or so of cancer cases. Alcohol is also a similar public health challenge and also specifically impacts cancer burden and is one that needs action and investment. A group, though, that we don't think about often is infectious causes. So viruses like human papillomavirus or hepatitis are in fact significant contributors to cancer cases. About 13 to 15% of cancers are due to infections such as viruses. And this is why from WHO, we're calling on governments to fully act on the elimination of cervical cancer as one important area of making progress in cancer prevention and control, a call that our Director General made about 2 years ago.
Okay. Andre Ilbawi, thank you so much for joining us there from Geneva. Very much appreciated.